Hi, everyone. I'm Brent Weinberg, the founder of LearnNeuroRadiology.com. Thanks for tuning in to stroke case number 4 that goes along with the stroke imaging series. If you haven't checked it out already, go back and check out the first 3 cases and the general imaging component. But we're just going to dive right into this case right here. This is a 50-year-old presenting with altered mental status. Here we have 2 images from a non-contrast CT, one through the posterior fossa. Doesn't look too bad. I'm not seeing any territorial areas of infarct. Looks okay. Coming up a little bit higher. Again, it still looks okay. Like I'm not particularly worried about anything there. Nothing that looks territorial. No hemorrhage. Here we move on to have our CTA, and I get a little bit worried. Here we've got what looks like the basilar artery here on a coronal MIP. That's probably the superior cerebellar artery there. And then we see no connection to either PCA there. So probably some thrombus there at the basilar tip. That's a very dire area that we have to worry about. Here again, looks like I'm probably catching that right PCA there, and the basilar is supposed to be right there, and it's not filling. It's probably occluded there. Now this axial down a little bit lower is a little bit confusing because we've got an artery, a single artery that's opacifying there. Ironically, that's probably the right vertebral artery because we see this shadow of a left vertebral artery right here, and that's going to be confirmed on the angiogram. So here we see AP angiogram here injecting the right vertebral artery, comes up. And then we've got some irregularity kind of right where the left vertebral artery should be coming in. And here we have, it looks like we really don't see that right PCA there. And it looks like that basilar tip is probably occluded. The patient went on to have a thrombectomy here. You can see a little bit better on this injection. Now the right PCA is opacifying there. So we've cleared the thrombus out of that PCA and the basilar tip there. You can see a little bit of what's going on in that left vertebral artery now because the distal part is very narrow there and you're not refluxing contrast back that much further. So there's a thrombus there in the intracranial portion of the left vertebral artery. So this is a case of an occluded left vertebral artery and basilar tip. Now, interestingly, you see, even though the left vertebral artery was the one that was occluded, we ended up with an infarct in the right superior cerebellar artery territory. But the great thing about this is that thrombectomy really saved all of that right PCA territory. There really wasn't involvement of the right PCA territory. So the combination of early intervention and a bunch of collaterals probably saved that area. Now, when you see a basilar thrombus, remember, that's a special case. They have such bad outcomes that they're much more aggressive about late intervention. They may continue to intervene on these patients for up to 24 hours after symptom presentation. So you want to be very careful about not missing these, even when it's a little bit of a delayed presentation, because it is an opportunity to intervene. Thanks for tuning in to this last case, case number 4. In the next video, we're going to talk about complications of stroke and some mimics that you might look out for. So thanks for tuning in. Be sure to like the video and subscribe so you see additional videos when they come out. Thank you.